Okay, thank you, Naji. Thank you very much, and good morning, everybody. It's great to be here, and no pressure to be starting the morning. So I hope that you're interested and you enjoy what I have to say. I just want to check that you can see my slides. So my name is Stephanie Daley. I'm here this morning to talk about the Time for Dementia programme. And I'm specifically going to be talking about the experience of families taking part in the programme. So if we could move to the next slide, please. I think many of you listening will be aware of Time for Dementia, but for those of you who are not, I'll give a brief overview. So Time for Dementia is an undergraduate healthcare dementia education programme. So it's really for the future health and social care workforce, and the aim of the programme is to improve the dementia knowledge, attitudes and skills of the future workforce. The way in which the programme works, so typically students undertake 6 visits to a person living with dementia and their carer at home over about a 2-year period. There are other supporting activities, but the sort of key focus of the programme is that students learn from the person with dementia and the carer about what it's like to live with the condition, and they also learn about how it changes over time. The programme is delivered in partnership with the Alzheimer's Society, and it's delivered as a mandatory component of the curriculum. And what that means is that students don't have a choice about whether they do it, they have to do it. So all of the students doing the programme take part in the visits. It was set up at Brighton and Sussex Medical School and at the University of Surrey. And since its inception in 2014, it's been delivered to 7 universities and across 8 different training programs. So it's expanded beyond just doctors, nurses and paramedics. So it also includes a number of allied health profession programs, and it has been developed over distinct phases. So we're currently in phase 3, thinking about phase 4 of the development. And what I'm going to be talking about today is some of our data from the first 2 phases of the program. And just to give you an indication of numbers, so we've had to date 5,595 students do the program, and our colleagues at the Alzheimer's Society have recruited 1,680 families to take part in the programme. So just to put it into context, and as I've mentioned, the focus of today is to tell you a bit about the experience of families taking part. Could we have the next slide, please? And just very briefly to put this into the context, just in terms of what we know already, or what sort of model. So sort of involving people with dementia and their carers in education isn't sort of in itself new, but there are different ways in which it can be done. I guess the first one, which is probably the most common approach, is having some lived experience or patient education sort of input as part of a one-off teaching session. So typically that might be a sort of lecture on dementia, where either the person with dementia or a carer comes along to part of the session and shares their experience. The challenge, I guess, or the limitation of that sort of approach is that it's just one point in time. And often the people who may be talking at those sorts of sessions may not be typical. Then they tend to be people who are quite confident about public speaking, so may not give you the sort of breadth of knowledge about what it's like to live with dementia. The second model, and this is where Time for Dementia fits, is a sort of long-term experiential model. And what we mean by that, a bit jargony, but what it means is a program that takes place at least over 6 months or longer. So it takes place over time, so people can see how the condition changes. That it involves a relationship, the development of a relationship between student learners and somebody living with dementia. It may or may not be mandatory, and typically there are some of these programs that happen already, particularly in North America, tend to be delivered as a sort of elective part of the component, and typically just with medical students. The final model is something which focuses on activity or doing an activity with a person living with dementia. So typically these are sort of projects that involve the creative arts. So it might be a museum visit, might be an art project, might be a theatre project, whereby students will come together with people living with dementia to engage in an activity, and by doing so learn more about living more about the condition. So those are the sort of models that sort of currently take place in terms of involving people with dementia in healthcare education. If we could move forward, please, Matt. And just in terms, so the focus of what we're talking about today is about people's experience, what we know from some of our early work in Time for Dementia. So at the beginning of the program, we did a qualitative study with 37 people living with dementia and their carers, and at that stage we found 4 themes: motivators to take part. So there was a lot of focus on doing things to help other people with dementia for the future, the value to families, so social interaction for the person with dementia and an opportunity to share experiences with the carer, a sort of motivation to sort of to improve student understanding, student learning, and sort of some key student factors. We looked in 2020, so we did a scoping review trying to sort of understand a bit more about the experiences of people involved in people with dementia involved in the education of healthcare professionals. And we found 23 different studies, 23 different programs, but the focus within those programs was really about the students and what impact it had on the student outcomes. And of course that makes sense, but given that these programs involve people with dementia, it's really important that we understand their experiences. We have obviously a duty of care to the 16 plus 100 people that we've recruited to the program. The program is delivered in partnership with people with dementia and their carers. So therefore, we obviously need to understand experiences, so we can use that to sort of refine and further develop the program. And finally, we do have very grand aspirations for time for dementia, and we would like to see this as a sort of model of choice or program of choice for all healthcare professionals. So understanding what the experience is really helpful to enhance recruitment of families. We could move forward, please. So what I'm going to talk about today is some of the work we've done, or some of the data we've gathered on time for dementia and data that's helped us to understand the experience of families. 3 key questions. So firstly was about the characteristics of families taking part. Secondly, the satisfaction and views of families. And finally, whether there were any factors that might influence satisfaction. We could move forward, please. So in terms of methods, so we've had a longitudinal design. So we gathered data, information from families before they had students' visits and at the end of the program, so at 24 months. We had 2 phases. So we had the initial phase of students between 2015 and 2018, so our initial families who took part, and then the second phase of the program rollout was between 2018 and 2021. Slight difference in both data that we gathered and how we did it. So in the first phase, we had research assistants visit families at home. In the second phase, we collected data by telephone, principally with the carer of the person with dementia. So we've got data from about the first 6 years of the program, 2015 to 2021, and as I've mentioned, in the first 2 phases. If we could move on, please. And just in terms of some of the data we collected, so at baseline, so before visits started, we looked at the demographics of the families taking part. We also asked at that stage for families to complete measures. And then at the end of the program at 24 months, we looked at the number of visits that people had been involved in, the types of visits, because those changed over the COVID period. And we also asked both the person with dementia and the carer about satisfaction with the programme. And so we had a survey that looked at 13 different areas, including also some open text responses, and we repeated those measures. And in the first phase, we looked at carer burden, we looked at severity of dementia, and we looked at care of life in the person with dementia. In the second phase, we didn't look at carer burden, but we looked at quality of life in the care of the person with dementia, looking at measuring that with C-DEMQOL. We also looked at quality of life in the person with dementia. We looked at social functioning in the person with dementia, and we also looked at dementia severity and functioning. We could move on, please. So in terms of the results, and so this is our first question about the characteristics of families. So in terms of the number of participants taking part in this research, we recruited 803 families, 400 in the first phase, 403 in the second phase. But at 24 months, when we did the follow-up, just over, so 55% of those families completed follow-up measures, 442. So the median, so the most common number of visits that people had experienced was 4 at that point in time. And in terms of the characteristics, 20% of the carers involved and 2% of the people with dementia at baseline were working. 81% of the carers involved were spouses or partners of the person with dementia. And the most common age, the median age, was 79 years for the person with dementia and 73 years for the carer. And at the beginning of the programme, less than 1% of the people with dementia were living in a residential care facility. And at the beginning of the programme, so when we looked at dementia severity, the most commonly people had what we would term a mild dementia at the beginning of the phases, in both phases of the research. So that was the most common, but we did also have people with more advanced dementia throughout the programme. If we could move on, please. In terms of satisfaction, so as I mentioned, we had a 13-item satisfaction survey and a Likert scale, asking people to rate either strongly agree down to sort of strongly disagree. And in terms of carer satisfaction with the programme, what you'll see is that the majority were either strongly agreed or was sort of strongly agree or agreed in terms of high levels of satisfaction, most typically strongly agree. If we could move on to the next slide, please. So the person with dementia, again, high levels of satisfaction, although what we see is a slight difference here, that more of the people with dementia sort of rated it as agree rather than highly agree. If we could move on, please. And just in terms of sort of some overall sort of stats, so what we saw with carers was that 90% agreed or strongly agreed with the statement, I feel that I have been actively able to contribute towards the education and learning of students involved. 99% of those who responded agreed or strongly agreed with the statement, I enjoyed talking to the students. And 85% agreed or strongly agreed with the statement that their loved one enjoyed undertaking the Time for Dementia programme. We could move on, please. For the person with dementia, 88% agreed or strongly agreed with the statement that I feel like I've been able to actively contribute towards the education of students. 94% agreed or strongly agreed with the statement, I like having students visit me, and 95% agreed or strongly agreed with the statement that I would recommend Time for Dementia to other people. So quite high levels of satisfaction in both the group of carers and people with dementia taking part. If we could move forward, please. What we also did was look at we also tried to look at whether there were any factors that might predict or be linked with satisfaction, and we separated this between satisfaction with the way that the programme had been organised and comfort and enjoyment of the programme. And what we saw for carers, so we saw two factors were sort of significantly associated with satisfaction in terms of the programme organisation. First one was there was a slightly higher level of satisfaction in the first phase of Time for Dementia compared to the second phase. And our thinking is that that's probably to do with the fact that COVID impacted upon delivery of the program in the second phase, and we had to change the way in which the program was organised. However, what we did see was an association between the number of visits, and crudely put, the association is the more visits, the higher the level of satisfaction, which perhaps isn't surprising, but I guess reassuring for us. So that was certainly a factor in organisation. It was also a factor for carers in their comfort and enjoyment. So the more visits you have, the more that you enjoy it. And that is also important to us, because what we do is that we ask families to remain in the programme if they're happy to. So about 75% of the families between cohorts remain with the program. So that's part of our sort of longer term strategy about, keeping families engaged. So that's really helpful for us to know. If we could move forward, please, Matt. The next chart is just looking at person with dementia satisfaction. So in terms of organisation, similar pattern. So the number of visits affected satisfaction, it sort of impacted upon satisfaction with the program. So the higher number of visits, the more highly satisfied with the organisation with the program. We also looked at comfort and enjoyment, and interestingly what we saw was that there seemed to be a relationship between the age of the person with dementia and degree of satisfaction. And what we found was that younger people with dementia appeared to be more highly satisfied compared to people who were older. Now, both groups were satisfied with the program, but what we saw is a slightly higher level of satisfaction for younger people with dementia. But other than that, we didn't see any factors. If we could move on, please, Matt. Just a quick sample of some of the sort of feedback from both groups in terms of best aspects. So for both groups, high level of social interaction was highly rated, was the most valued part for both people with dementia and their carers. Followed by feelings of making a difference, that being a really significant factor in terms of what the most valued part of the program, and also student behaviour. And there were often things about individual students, about how much families enjoyed getting to know them, how impressed they were by students. So the sort of individual students will, not surprisingly, have an impact on the degree of satisfaction. If we could move forward, please. So there's a few quotes here just from some of the families about their experience in terms of social interaction. If we can move forward, please. In terms of, we've got some examples, some quotes here from impact of making a difference. So these are certainly things that we can harness in terms of future recruitment of Time for Dementia. If we could move on, please, Matt. So to conclude, what we've seen from this data, and we're really pleased to be able to say this, is that the level of family satisfaction with Time for Dementia is really high. And we can also sort of say with some confidence that there's no modifiable factors influencing family satisfaction. And what I mean by that is that beyond talking about the number of visits and age, there aren't things that we can automatically change in terms of any sort of factors influencing satisfaction. This data, and there is more data, I've obviously just got a short amount of time to talk to you today, but we have a lot more data here, and what we're able to do is to use that to improve the program and to sort of help prepare the students to do the program. And I guess finally, a small point but important point is that when we collected this data, it's quite difficult for people with dementia to sort of recall sometimes their feelings about visits that may have happened some time ago. Dr. Sam Robertson and myself have been doing some work where we've filmed some of the visits, and we've used those video recordings to go back to the person with dementia and interview them about their experience. And the things that they've talked about in terms of significant factors is about the importance of helping others to learn about living with dementia, and this sense of being valued and being needed through this experience. And again, probably not surprisingly, the value of interacting with students were also was also a significant factor. We could move to the next slide, please. That's it from me. We'd love you to follow us on Twitter. We've got a website. I've just realized I've made a typo there. I'll put the correct address in the chat box. But if people are interested, people with dementia listening, and their carers like to take part, do email us and I've made a typing error, but it's timefordementia@alzheimers.org.uk. Our colleagues at the Alzheimer's Society would always be really pleased to hear from you. And that's it really from me. If you have any questions, I'd be happy to take them now.